It's perfect that you just said what you said, because that was one of my questions. I wanted you to talk about the relevancy of COVID right now on mental health, skyrocketing suicide rates. I'd like to know what you've dealt with in terms of an uptick in anything, or just what your opinions on COVID are. Not COVID itself, but for what we've seen in the mental health world, of people having a very hard time coping, loss of business, loss of jobs, people being forced to interact with each other, more heavier alcoholism, heavier drug use. COVID, there's a quiet, untalked about scourge that's come about with COVID in the mental health world and drug abuse world, that I want you to speak on. Everyone's talking about the clinical part of COVID and masks and vaccines. But what's not being discussed at all, certainly by the media, and nobody's talking about, is the suicides, the depression, and the despair centered around COVID. And when does it end? Because it doesn't seem like COVID's ending anytime soon. And I'm just curious on what your take is on the role of COVID in everything that I just mentioned.
So, I'll sort of split up my answer. A drug addict doesn't need COVID to do drugs. It's just another reasonable excuse. So, I don't know if there's been an uptick in drug use and drug addiction because of COVID. There's been isolation, and there's been, because of isolation and loss of job, and there's been, depression and all of that. But an active addict is an active addict. Addicts don't care if there's a hurricane. They're going to find their drugs. So I don't know, and I don't have the research in front of me, but I have my experience, and I know addicts like the back of my hand, and I don't know that COVID has done anything to enhance or increase the drug problem, if you the drug problem in the United States. I think the problem exists. It's more talked about now because I think people are isolated, and because I think that there's been a rise in public opinion of mental health issues. Now, mental health issues have increased because of things like less socializing, less interaction, loss of job, loss of money. All of that leads to depression and anxiety. Perhaps people couldn't get to their medication, can't afford their medication. So yes, there's definitely been a rise on that. We've done things as a country to counteract that. For example, one simple example is, we have these Zoom meetings and parties and interactions, and kids that are graduating, they do drive-bys. People applaud them in the neighborhood for graduating high school or college or what have you. And the feedback is, oh, that was pretty cool. It's not the same, it's different, but that was pretty good. So I sort of see people trying to overcome it, but we still have the issue of the depressed and the anxious person that that optimism is fleeting for them, and they need help. It's just like the woman that was psychotic that pushed the psychiatrist through the wall. Don't ignore these people, and we need, bottom line is, we need people to give a shit and to be empathetic and compassionate towards one another. That everybody's struggling right now, and this epidemic has definitely impacted us. In some ways it's shown the ugly side of us. In other ways it shows the good side of us. But there are ways to communicate that are different than they used to be. A mask is just a mask. It doesn't mean that you're diseased. And I think the media does a poor job in sort of, they focus on the problem rather than the solution. I'd like to hear more about the solutions that people have come up with to socialize in unique ways. I'd like to hear more about programs that are out there that are servicing the mentally ill and that are getting medication to people that need medication. So, I'd like to see that. But I will tell you this, and this is a good thing. As a result of this, public opinion of mental health is now in the conscious of the country. And people are starting to recognize that mental illness is real. It's not made up. It doesn't mean that you're retarded. It doesn't mean you're stupid. It means that you have a disease, you have a sickness just like anything else, and you need help. And hopefully, God willing, through this insanity that we're going through with COVID, that people will realize the need that's out there through the whole country, state by state, all of that. We're not there yet, and we're not really even close, but we can definitely do this. So those are my thoughts about COVID and mental health and addiction.